Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
Coronavirus diagnoses are soaring across the Midwest and across the metro, but leaders can't get on the same page for mitigation methods, and that could be dangerous, as St. Louis Public Radio reporter Sarah Fentem explained on today's St. Louis on the Air.
You're not only looking at different restrictions in the city and the county, you're looking at all the different counties around. Like, I was in Jefferson County yesterday. I was coming back from hiking down in the St. Francis Mountains, and nobody was wearing a mask there because it wasn't required. Like, I was at a QT and, I think I saw one other person, but they're not required down there. Mm-hmm. You're seeing the governor and the state health department having sort of different messaging. You're seeing the county and the city having different messaging. And I can understand why people are kind of throwing up their hands and giving up, because if you're hearing so many different things from so many different authority figures, it makes sense to me that you would just get exhausted, right?
I'm Sarah Fentem. This is St. Louis on the Air. The metro area has seen an average of 2,206 new COVID-19 cases per day over the last week. That's up 43% over the week prior. So far, to date, 2,036 people in the region have died. Dr. Alex Garza, commander of the St. Louis Metropolitan Pandemic Task Force, stressed at a press conference Friday how close we are to overtaxing our local healthcare systems.
We are also asking the state to work with our system's emergency managers to start planning for what will happen when the healthcare systems become overwhelmed. Our healthcare heroes have fought valiantly day after day, but we have no reserves. We have no backup that we can suddenly muster to come in and save the day. If we stay on the path that we're on, even just 2 more weeks, we will not have the staff we need to care for patients. It's now just a numbers game. We are danger close.
That is Dr. Alex Garza. And those numbers come with a real human cost. A St. Louis area woman held back tears late last month as she pleaded for the public to follow public health guidelines. Jennifer Duffy's mother died in late September after being diagnosed with COVID-19.
It's really easy to catch COVID. My mom was so careful. That's the scariest thing. It's devastatingly quick. In 14 days, she went from being perfectly healthy to gone. We weren't able to be with her. She fought 4 days in the ICU, and I thank all the nurses who were her family for her, because we could not be. What's harder than the grief of losing her is the state of this world and the disgust that I feel when I see the values she brought us up with of love, respect, and kindness not apparent in the people around us. And I don't understand why it is so hard to sacrifice to wear a mask if it can save somebody else like my mother. There's just too many people hurting right now, and I ask myself every day, how many more?
That is Jennifer Duffy, who lost her mother to COVID-19. Now, late last week, both St. Louis Mayor Lyda Krewson and St. Louis County Executive Sam Page announced new restrictions aimed at curtailing coronavirus spread. And here to tell us the latest on all these fronts is St. Louis Public Radio health reporter Sarah Fentem. So, Sarah, welcome back.
Hi, how you doing?
So we got some pretty dire warnings on Friday. We heard a little bit of what Dr. Garza had to say about danger time. What are public health officials asking us to do right now?
So that press conference came right after the county announced sort of these new restrictions on businesses, which is what got a lot of attention on Friday. So credit where credit is due. Our intern Becca actually covered this because I had to cover Morning Edition, so she did a great job. And so what she found is that these new rules they're not as stringent as what we looked at last spring. But the big news is, I think, one, no more indoor dining in county restaurants, which is something that they've been doing, especially as the weather has gotten colder. And then capacity limits in all businesses are down to 25%. They were at half capacity and now they're at a quarter capacity, according to the fire code. And then also there are a few different like mask restrictions, especially as pertaining to, youth sports, like when people have to wear masks. But basically that mask mandate has been in effect for a while, and it continues to be in effect. Like if you're in public in the county and in the city too, you have to wear a mask.
Okay. So those are some big changes in the county. Is the city seeing similar levels of change?
Levels of change in terms of the restrictions, no. I think once, the county said, oh, we're going to tighten these restrictions back up, everybody was looking at the city and seeing if they were going to follow suit. And they sort of did. Just like the county, the city announced that gatherings of any kind are being restricted to 10 people or fewer. And that was the big announcement from the city. And so everyone's like, but what about businesses? Currently, businesses aren't looking at the same restrictions as the county. So this is one of the first times that we've seen the county and the city have, I don't want to call them drastically different, but they are not on the same page in the same way that they were earlier on in the pandemic.
This is a divergence. I remember at one point the county had shut down its parks and the city never did that. But short of that, I can't think of something this big in terms of
and
St. Louis
that was
County
a big
restaurants.
deal.
Yeah.
And now this is drastically kind of different. Well, I don't know if it's drastically. It's definitely significantly different approaches.
I saw a quote from Dr. Alex Garza last week where he said, you cannot have an effective campaign strategy with 5 generals. Do we currently have 5 generals? Is this a problem?
I think we have lots of different generals because you're not only looking at different restrictions in the city and the county, you're looking at all the different counties around. Like I was in Jefferson County yesterday. I was coming back from hiking down in the St. Francis Mountains and, like nobody was wearing a mask there because it wasn't required. Like I was at a QT and, I think I saw one other person, but they're not required down there. You're seeing the governor and the state health department having sort of different messaging. You're seeing the county and the city having different messaging. And I can understand why people are kind of throwing up their hands and giving up because if you're hearing so many different things from so many different authority figures, it makes sense to me that you would just get exhausted, right? And so I think that Garza had a point where you're not seeing a unified response in any sense at this point.
And are we seeing a substantive difference between the city and the county in terms of cases? Is the reason the city isn't cracking down on restaurants, say, the way the county is, that the city's doing a whole lot better?
And I mean, that was something that Mayor Cruson brought up on Friday, and she isn't wrong. So I checked the numbers right before we started today, and per 100,000 people, St. Louis County has 374 new cases on average, and then St. Louis City has 238 cases per 100,000 people, which is still a whole bunch of cases, but
there is a difference there.
Yeah, there is a difference, and I think that I don't know if that has to do with politics or with messaging or what, but you are seeing not as much spread within the city as you do within the county, and that could also be because the county is like really, really big and encompasses a whole bunch of different kinds of people who have different views on things, and yeah, but I mean, like that was a point, but I think it also misses the point that, I mean, like if you're a city resident, you go out to the county a lot, you go to the mall in West County, or you go to, like
there's not a wall between these two entities.
There isn't. Well, most
short of Jennings, as it turns out.
Yeah, right. I was going to say Jennings.
It's a little digression there.
Yeah, but yeah, I mean, like I think that it's not like these aren't permeable. Like it's a metropolitan area, and so that was one of the criticisms that I heard from the task force is like, it's not like, yeah, there's not a wall in between the city and the county, and in between the county and Jefferson County and
St. Charles County.
Yeah, exactly.
Yeah.
It's like this is it's just a big mass of people, no matter any way you cut it.
Well, so bigger picture, the reason that we're talking about all these new restrictions is that we're worried about our healthcare systems being overwhelmed. And Dr. Garza seemed to say, hey, we're very close to this happening here. Do we know, have things gotten worse on that front since what we heard Friday?
I took a look. I know I get an update of new admissions every day from the task force, and it looked like new hospital admissions. It's so funny to talk about these numbers because they're so astronomically high. And so if you're looking at like a difference between, 114 new admissions versus 96 new admissions or whatever, like it did look like it went down a little bit like over the weekend, but I mean down from it's still like this hugely high number, and I don't think it makes that much of a difference
once you're that high.
Yeah, I mean, like what I remember hearing was they were not happy, but they could manage about 40 new admissions for the coronavirus each day. That's what they've said is the baseline of what the highest point they want to see. And then now you're looking at numbers of daily admissions that are twice, if not three times that high. And so I think what the sense that I got at that press conference was it's only a matter of time until they just become completely swamped.
My guest today is St. Louis Public Radio health reporter Sarah Fentem. Sarah, we're getting a couple of questions on Twitter, and I think here's a good one that comes from John. He writes, hospitals are already pretty much at capacity, and any action we take now to reduce public exposure won't protect the thousands of people who have already been exposed but not tested yet. What can hospitals do to meet the already baked-in demand they're facing in the next 3 weeks? Any thoughts on that? I know that's kind of an impossible question because it's an impossible situation. What will happen if we hit this point that everyone keeps saying we're going to hit?
It's a good question. It's one I'm looking into. What I have heard is, it's everybody's working overtime and they're working really, really hard and they're trying their best. As far as plans of like who, triage policies of who gets what care if there is a critical shortage of people or supplies. That was something that people talked about a lot in the spring, and I think it's a question that is going to be brought up very soon now as well. Because everyone was so worried in the spring because we heard all of these news stories coming out of Italy about people, not being given a ventilator or not being given an ICU bed because there wasn't room. And we thought, oh, God forbid it'll happen here. And it didn't, luckily, back in the spring. But it's sort of like all of that progress was erased. And now we're having that conversation again. I don't know for sure. It's something that I'm looking into. So stay tuned. The sense that I got from all the doctors was that kind of decision making is imminent if something doesn't change very soon.
And what about testing? I know there have been periodic problems with people being able to get tests when they need them. At this point, is the sense that if people need to go out and get tested for this, there is a test available, they can get this processed in a timely way?
I think like a lot of things, it depends on where you live in Missouri. Like I can't speak for central Missouri or more rural areas where, healthcare access is an issue there in normal times. And so if you live in a rural area and you need to get a coronavirus test, but you don't have transportation or anything, that's an issue. Here in St. Louis, we're seeing more and more tests being done every day. And it's the good news is that those tests are coming back more quickly. Around the middle of the summer, we heard a lot about tests taking like 2 weeks to come back. Now I think the average is something like 2 or 3 days, which is a lot more manageable when it comes to quarantining yourself until you're safe. So it is better. It is not a perfect system. I know, like, I've gotten a coronavirus test a couple times, and I just go to an urgent care, and they used to be taking appointments, but now you just have to kind of go. It's first come, first serve, and you have to wait in your car. So again, the access is an issue depending on, like how much time you have, how much flexibility at work you have, that kind of thing. Because I remember I had to wait for, I think, like an hour, and I was lucky that I didn't have anything to do, and I have a job that's flexible, but a lot of people don't have that kind of time.
That's an excellent point. Well, look, I mean, we're at this point, we're, I think, 2 weeks out from Thanksgiving, and there's a lot of talk about how are people going to manage this holiday with everything that's going on. You're a health reporter. You've paid close attention to what's happening here. What would be your advice for people when it comes to Thanksgiving?
Don't see people outside of your household. And I know that I know saying that is, probably pissing a lot of people off, but the fact is, I hear a lot of people saying, oh, how did I get COVID? I was so careful. I only saw a couple people. I only saw my one friend, but it's like, or I only saw my one, my sister. Then you have to think like, okay, well, what is the one person that your sister's seeing, or the one or two people that your sister lives with? And the fact is, it's like, this is a respiratory virus, and it gets passed from person to person, and it doesn't really give you credit for trying most of the time. It's just looking for like a warm body to
literally.
take up. Yeah, it's literally looking for a warm body to take up residence in. And so, I mean, we just made the decision that we're not going to go see our family for Christmas, because there's no way that we can have everyone quarantine for the 10 days, 14 days that you need to before. I would say, if you really want to see people in your family, you can sort of quarantine yourself for, I don't know, I think you have to start yesterday, but just stay home and don't have any contacts, and then make sure they don't have any contacts, and you could do it that way. That's so unrealistic for so many people. And so the bottom line is, the safest thing you can do is just stay with the people who you live with, or something that the county has been advocating for is like this idea of COVID pods, or like they call it a bubble, a pod, a bubble. Basically, it's like one other household that you only see them. And that's also become something that they're really advocating for, because contact tracers are completely overwhelmed, and they think, okay, well, if you get sick, you can just call your coronavirus pod. You can act as your own contact tracer. And so my advice would be just to like plan it for another time. Unfortunately,
there will be next year.
You don't want to get sick. You don't want your family to get sick. I'm thinking a lot about, I follow a lot of nurses and healthcare workers on Twitter, and they're so upset right now because they feel like no one's listening to them. And what I hear a lot is like, oh, we're drowning. And if you ever think it's really hard, just, like, think about having the people who have to spend Thanksgiving in the ICU, and that makes it a little easier, at least.
If you learned something new from today's episode, consider leaving us a review and rating on Apple Podcasts on the App Store. It's the easiest way to help people discover our show. We appreciate it. Thank you.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.